All right, so my name is Drew Hilbrandt. I'm a physician assistant. I'm also an assistant professor and the clinical coordinator for University of Michigan-Flint's physician assistant program. So this presentation, I'll talk a little bit about from a high school perspective, coming up through college too. This is was geared a little bit more towards colleges from some of the college guest lecturing I've done too. So what we'll kind of cover today is what a physician is, where to start, programs, how to get into a physician assistant program, what a physician assistant program looks like, certification. So I'll start with high school. So it wasn't '06. I'm a little bit older than that. So I graduated high school in 2001. I'm from Saginaw, Michigan. I went to Western Michigan for college for undergrad. I knew at that point I had wanted to do something in the medical field. Now, from a perspective, no one in my family has any sort of medical background, any type. My father owns a restaurant. My mother is a stay-at-home mom. I have no family member in healthcare. I just kind of knew I was always interested in some sort of perspective of it, but I didn't know what. So I went through college at Western Michigan. I ended up enrolling in the pre-med curriculum. So then what happened is I ended up graduating in 2006. I had a bachelor in biomedical science, minor in chemistry, magna cum laude. But I still didn't really know what I wanted to do as far as healthcare realm. I knew I wanted to be more directly involved with patients as far as care direction. So that kind of took nursing out for me. But I also knew that, from what I was able to gather from talking to people, online, looking at medical schools and such, like maybe going the physician route wasn't exactly what I didn't want to do because of the time essentially it takes to go through medical school, residency, fellowships, to gain your practice. And in that, I kind of wanted to more get into something where I was going to get involved a little bit quicker. So I was looking at other stuff too, as physical therapy, occupational therapy, and that. So then right pretty much 2 months after I graduated, I moved back to Saginaw, and then I met who is now my wife. And my wife at the time, she worked at McLaren Bay Regional in Bay City in their cardiac cath lab. And we were talking, and she said, "What about physician assistant?" Of course, I said, "What is a physician assistant?" Because I had no idea. So physician assistants are medical professionals who diagnose illnesses, develop and manage treatment plans, prescribe medications, and often serve as the patient's principal healthcare provider. With thousands of hours of medical training, PAs are versatile and collaborative. This is from the American Academy of Physician Assistants. So really, when you go to look to see what a physician can and can't do, some of you probably know, if you've been to a family practice or a hospital, you've probably been cared by a physician assistant before, but PA's specific duties depend on the setting in which they work, their level of experience, their specialty, and state laws. So generally, PAs can do everything that's listed here. And I've actually done all of these things at some juncture. You take medical histories, conduct physical exams, diagnose and treat illnesses, order and interpret tests, treatment plans, prescribe, consult on preventive care, perform procedures, assist in surgery, hospital rounds, nursing homes, do clinical research, administrative duties, and academic holdings. There really is no limit essentially to what a PA can do in the medical profession. So to become a physician assistant, when I started looking into it a little bit more, it's a master's degree. Most programs are 24 to 36 months. PAs practice in every state and every medical setting specialty. One of the things that when you talk to someone who's interested in becoming a PA or why they looked into getting to PA school is the on-the-job training and crossover specialty. So what this means is when you become a physician, you go to medical school and then you go to your residency. Your residency is essentially what you're going to do for your career, emergency medicine, family practice, urology, and such. And that's how nurse practitioner school, how from nursing to become a nurse practitioner, that's how it's divided up a little bit too. PAs are different. When you graduate, you just become a physician assistant certified, and you can cross over to any specialty you want. I worked with a PA who was a cardiology PA for 6 years, then came over to surgery. I worked with a PA who worked with an ophthalmologist, an eye physician, for 2 years, then came over to trauma. I've also known a surgery physician assistant who went over to pediatrics. And when talking to people who are interested in becoming a physician assistant, this is always kind of one of the hitters that people always touch on. because of maybe you think you like emergency medicine, you do it, you maybe don't like it, and you want to go do something else. That's where this is one of the big things that comes into play. And I also like to mention this too is the difference between PAs and nurse practitioners, because we are kind of clumped together into what's called advanced practice practitioners. It used to be called mid-levels, but people thought that was kind of derogative, so they asked to change that to advanced practice. But I always get asked, what's the difference? So here are the two main differences. PAs are educated in general medicine, which offers a comprehensive view of all aspects of medicine. NPs must choose a population focus, e.g. pediatric nurse practitioner, women's health practitioner, kind of what I'd mentioned before. Also, PAs are trained to practice medicine using a curriculum model based on medical schools. So how our programs are developed are very closely related to how medical school programs are as well. Nurse practitioners, their training is a little bit different. It's an advanced practice of nursing. So why think about physician assistant too? Well, when you look at the Bureau of Labor Statistics, they predict that employment for PAs will actually increase by 37% from 2016 to 2006. So that means job opportunity. And physician assistant profession is currently ranked third in best jobs and second in best healthcare jobs by the U.S. News and World Report. The first healthcare job is dentist, which I thought was interesting. For the last 4 or 5 years, PA has been going back and forth between 1, 2, and 3 as far as top jobs and also healthcare related jobs. It's also a top 10 master's degree by Forbes. What I didn't put in here, and what I sometimes mention is also, people ask monetary too. As of right now, an average physician assistant coming out of school is looking to start an average salary around $96,000 to $98,000. Again, depending on your specialty. The more subspecialized you are, the more you will get coming out of school. So why is there such a demand? Why is there such a requirement for PAs? Why I think it's going to increase? A big reason is the aging population and projected retirements of healthcare workforce, current uninsured and underinsured individuals. Major shortages are projected for the U.S. healthcare job market in the coming decades, and cost benefits of advanced practice providers, PAs and NPs, compared to physicians. Because if you looked at what I said previously, what a PA can do, an NP doing the same thing, it's just almost exactly the same as a physician. We're just cheaper. So where do you start? In high school, I mean, this is good. This is what you want to do right now. You want to talk to PA. I mean, the best thing you can do when you're in high school, even when you're an undergrad in college, is if there's a profession you're interested in, actually talk to someone that's in the profession to get a better understanding of what they do, why they chose to do it, to see if that's something you're interested in or not. I actually became very slightly interested in architecture. Then I talked to someone, then I became uninterested in it. And then I got more into healthcare. So not that there's anything wrong with architecture, it just wasn't for me. But one of the best things you can do is talk to a physician assistant, talk to a healthcare provider, if that's an interest you have. And this can be for any job. Job shadowing. It doesn't matter if physicians, PAs, NPs, a lot of people do this where students can come in from volunteer and job shadow them, even come to their office and shadow them for a few hours, at least to see what it's like a day in the life to be that kind of person. Again, that's something you should do for every type of job before you jump into your studies to actually graduate with a degree in that profession. Investigate job opportunities in your area. If you believe you're going to stay where you are, I would highly recommend looking to what's available and then also seeing what jobs are available too in the area. This may dictate if this is something you want to do or if you actually want to move. This did a little bit for me as far as maybe where I was staying with the job opportunities there when I moved back to Saginaw, when I got involved with Flint, which I'll talk a little bit later. Start thinking about clinical hours. A lot of professions, physician, NP, PT, OT, physical therapy, occupational therapy, nurse practitioner, PA, a lot of healthcare professions recommend that you get in and actually get some clinical hours. And that can be doing something totally different. If you've ever met the person when you walk into a physician's office or the hospital and they kind of talk to you about your history a little bit, take your blood pressure, check your vitals, check your heart rate, listen to it real quick, and then kind of walk out of the room. A lot of time that's a nursing assistant or a medical assistant. And that's something it takes a couple weeks to get certified in. You can go then and become that. a lot of schools require you to have some sort of clinical hours before you can even apply to get into the programs. And I'll talk a little bit about that later too. And then research PA programs and requirements. This is very important because, again, if you're interested in going to a profession, you really need to look at the schools that will give you the best opportunity for that profession to get through there, to graduate through. There is some name recognition, obviously, when you're going to a school. And so you want to look at, if there's a certain school you're looking at and you're interested in that type of profession, make sure that school has that profession available. And then the requirements too. All schools, no matter what it is, there's going to be some sort of variance between what you need to have done before you look to get into the program or apply to the program. So a little bit about PA programs and requirements. So there's 250, a little bit more now, about more than 250 PA programs in the United States. Admissions is highly competitive, requiring a bachelor degree and completion of courses in basic and behavioral sciences as prereqs, chemistry, biochemistry, biology, anatomy, physiology. Becoming PA students bring with them an average about 3,000 hours of direct patient contact, what I kind of mentioned before. Having worked as paramedics, athletic trainers, medical assistants, there's a lot of difference. Again, look at the program requirements. Some programs see certain things. It's not like massage therapist is one that always comes up where if someone's a massage therapist, does that really count? We do count that for our program as direct patient care hours. And then this is one of the enticing parts of why to think of become a physician assistant versus maybe a physician, is the duration. Most PA programs are generally 27 months from start to finish. And then when you graduate, you start practicing. It's a lot quicker than becoming, when we talk about a physician, I'm talking 4 years of medical school, generally 4 years of residency, probably going to want to do a fellowship. You get into medical school around 23, you're more talking about like 33, 34 before you're actually practicing medicine on your own independently. So again, I mentioned schools, PA schools. So again, I'm an assistant professor with University of Michigan, Flint. So this is University of Michigan's PA program. So we're one of many programs in Michigan. And there's some other programs too, but University of Michigan, Flint. And a lot of programs, when you look into those, one of the things you like to look at too, what tells you a lot about the program is their mission statement before you look at anything else. Just to give you an example of our mission statement is we want to prepare students to become exemplary physician assistant practitioners, leaders, and advocates through the best practices in teaching, learning, and service to our diverse local community and beyond. This tells you a lot about kind of what the program, what they're gearing towards you to do when you go through the program and up to graduate. Are they research-based? Are they public health-based? And that does make a difference. So you've decided you want to become a physician assistant. You looked at everything. So here are some of the requirements, again, that you would need to have done to get into PA school. What I put on here are our requirements, but also this is a generality of what other programs require too. Again, you have to have a bachelor's degree from an accredited college or university. A minimum cumulative undergraduate grade point average of 3.0. Most programs, this is the norm of 3.0 minimum requirement. Same thing for prerequisite grades too. Programs actually take those out. We will put biology, biochemistry, chemistry, put those all together and figure out the GPA for that. And that GPA has to be above a 3 point. So all prerequisite coursework must be completed, and courses for which credit was awarded by examination or advanced placement credit are not acceptable towards any of the prerequisite courses. This is kind of true, except now people are changing a little because of the pandemic. Some programs, if you went through a course and you do what's called a passing grade, where you actually don't get a grade, they just passed you. Some programs are actually letting that go because of the pandemic. But it's something to look into to see if that program you're interested in going to lets that happen or not if you have that. So prerequisite coursework must be taken at a regionally accredited institute of higher learning. All prerequisite coursework must be completed before a student submits an application, which I'll talk about in a second. And examples of acceptable UM-Flint course prerequisite options and course transfer equivalencies can be found of UM-Flint. So you want to make sure that if you go to multiple colleges, if you say let's say you go to University of Michigan, and then during the summer you go to a community college, you always want to make sure if that course you're taking transfers over to the program you're interested in. I did that for twice, and one of them actually didn't transfer over to almost all the PA programs I was looking into, and I actually had to take the course again, even though I had graduated from school. So how you apply to a PA program, it's actually kind of nice. It's all universal. It's on an online program called CASPA. There you can put in all your general information, and then it actually has, for different programs you're interested in, you can put in the little extra parts, and then you click the dots, you pay for each application, and you can apply to as many schools as you want. Most people on average apply to about 4 PA schools at a time. The reason why is because most programs get about 600, 700 applicants for about 40 spots. CASPER is a test that a lot of schools require you to take, and we'll get into it right now. GRE, which some of you have already probably heard of. A lot of schools, some schools do this and some schools don't require it. Us at University of Michigan, we do require it, and those are minimum requirements. This one's a little wordy, but I'll give you the gist. Essentially, healthcare experience. All PA schools require some minimum of direct patient hands-on contact. When we say direct patient hands-on contact, that doesn't mean volunteer hours, that doesn't mean job shadowing. It means you went in as a paid professional and took care of someone, again, as a medical assistant, a paramedic, like I said, a massage therapist earlier. There's a lot of different avenues you can go to look to get your direct patient care hours. But if there's certain schools you're interested in, please go on their website and look at them to make sure that they accept that as hours. Now, again, because of the pandemic, it's a little bit harder for some people to get in to get those hours. So some people are letting volunteer hours count towards those hours, job shadowing count as those hours. So, again, look into that too. And then also too, a lot of programs, you have to do a letter of recommendation, meaning you have to talk to someone and they write a letter to the university, to the program, talking a little bit about yourself, essentially kind of, if you want to say, hyping you up or tell them how you are, because remember, you're kind of selling yourself to the program at this point and why they should pick you into the program. But a lot of these letter recommendations, they should come from a healthcare provider, and not just looks good on admissions, but of course, if you're looking to get into healthcare and then you have a lawyer, someone like my father owns a restaurant, or like I said, an architect earlier, it's not going to look as good as someone who has letters of recommendation for people who are involved in healthcare and who actually work with you directly in healthcare. So again, talking about a program. So our program is 28 months. We have 16 months didactic, 12 months are clinical. Didactic is your on-campus learning and lecturing, how you learn learning the medical disease states from pathophysiology to why they happen, why it happens, how they present, what you should get from someone from their history, from their physical exam. If you're concerned with this, what do you do to test for it? And then how do you treat it? And then the clinical phase is you actually go out as a student and work in different areas, different specialties, internal medicine, surgery, for a year to get experience working as a clinician. So when you go out and start practicing, you can practice right away. Kind of an example for me was, which I'll talk about what I did as a physician assistant. I had most people on average from when they graduate and take an exam to when they practice, it's about 3-4 months. Mine was a little bit less than a month. I actually got emergency credentialed in, and I'll talk about that a little bit more at Hurley Medical Center because they needed you there. So you can actually start practicing very quickly, taking care of people. Just to show you some classes of what a clinical year or didactic year looks like for school. Anatomy is always a big focus. And when we say medical foundations, those are where you learn about disease states like hypertension, where you learn about diabetes. You learn about why those are, how those form, how the people present, how you tease it out. When you figure out what's going on, how do you treat it? And then also patient assessment. I worded a bunch of different ways, but this is where you learn how to examine, how you perform when someone looks in your ear, when someone listens to your heart, what you're actually listening for. It's not just doing it for fun, you're actually doing it to achieve purpose. And this is just to give you an example too of the clinical year. This is kind of general to what most programs have. Internal medicine and family medicine are heavy because that covers a multiple of specialties. But surgery, geriatrics, emergency medicine, women's health, behavioral medicine is psychiatry or psychology. In pediatrics, kids get their own specialty too because even though they can have the same disease as an adult, it's treated very differently and sometimes diagnosed very differently. So the clinical phase, so to talk about ours, when you go to clinical phase, it can be at multiple different places. So for us, because we're University of Michigan, Michigan Medicine, which was just rated in the top 10 in the US and top 15 in the world, we have about 50% of our clinical rotations will be through Michigan Medicine. And it's actually the highest population of physician assistants in Michigan. There's over 530 that work through Michigan Medicine. So you work more directly with physician assistants. And when you go out to clinical practice too, you don't have to work with just a physician assistant. You can work with a physician or a nurse practitioner, residents, midwives. Midwives, if people aren't familiar with that, they assist essentially taking over from pregnancy instead of an OBGYN. But we're also based in Genesee County because we're in Flint. We have a lot of clinical rotations in Flint. We also have a lot of rotations throughout Michigan and also the Upper Peninsula. So once you've gone through school, you got everything done, then the next step is you take the PANCE. The PANCE is your certification exam. This exam you take to turn your PA student to a PAC, PA certified. You take that and you're licensed, you can start practicing as a physician assistant. Then what you do is you do what everyone does. Every medical provider in the country has an MPI number, and you can go look this. You could leave right now and go look online. You can see my number. It's open to the public. DA license is your prescription authority. So I have a DA license 3 level, meaning I can prescribe very heavy medications to people, such as heavy narcotics, if needed, because of the profession I'm in as a physician assistant. Recertification you do every 10 years. I'm actually doing that right now. And then you get CMEs. You need to do 100 of those every 2 years. CMEs are clinical experiences. So you listen to a lecture and they give you so many hours worth of credit for that. And then you work and you pay off that student debt. So for me, like I said, I went to high school in Saginaw. I went to Western Michigan University. I graduated there with a bachelor's in 2006. I then looked into the PA profession. I applied and I got in my first round to Western Michigan, where I went for undergrad in 2010. I finished in 2012. And then, like I said, I got emergency credentialed in, where I worked at Hurley Medical Center for 4 years full time. I did trauma, surgery, critical care. That's adult and peds. In the end, I am covering 13 services. So you name a surgery I've been involved with. I don't know how many craniotomies where we remove a skull to someone's having a brain bleed, if you want to say it that way. Assist with that. How many abdominal surgeries, gunshots, stabbings, car accidents, broken legs. I've done everything and anything. The only thing I could say I haven't been heavily involved with surgical wise is OBGYN, except from a trauma perspective. Everyone gets in car accidents. And also procedures too. You name a procedure, I've probably done it too. Chest tubes, big central lines, big lines that go in the neck, in the groin, arterial lines. Also intracranial pressure monitors, you name it. Like I said, I did it there. And what was nice about Hurley, it's more on that level where it's physician assistant run there, essentially, where you're with the physician, but you're practicing on your own. So then I still work there per diem, meaning I work there every now and then, maybe once or twice a month. I left there in 2017. For 2 years, I worked at Michigan Medicine, University of Michigan's hospital, in acute care surgery. There I covered nights. So instead of going to the emergency department and seeing traumas or doing critical care, it was more just straight surgical care. Nothing in the operating room at Michigan Medicine. There I became more of a mentee and trainee to nurse practitioners and PAs who were coming onto the service. And then I actually took over as the first student coordinator for the section of general surgery, meaning I organized what I had spoken for about those clinical rotations for PA and MP students, what they would look like. And then kind of doing that is what led into me becoming an assistant professor and clinical coordinator for University of Michigan Flint's PA program. When I heard UM-Flint was starting their own program, I became very interested in that because I was kind of like teaching. And then my boss actually gave me the number for the program director, say, hey, see if they have any spots you'd like to be open to. So I actually called and talked to Stephanie Gilkey, the program director. And she asked me what I do and what I've done. I told her, and she said, well, do you want a coordinator position instead of maybe looking for part-time? And I thought about it, and I've been doing it actually for almost a year now, and I'm glad I did it. It's very fun. It's a different rewarding experience than just taking care of patients clinically to actually teaching people. And our first class actually starts in January. Any questions?
That was great, Drew. Amazing rundown and presentation.
Anything and anything I can answer if anyone's interested.
Yeah. So, what interests you the most about the job besides working with? What is that?
I'm sorry, can you say it again? I heard that what interests you most, but what?
So, like, what interests you the most about this job?
About physician assistant?
Yes.
Well, when I first was looking into it, kind of like what I said earlier, my big interest was I decided I wanted to do healthcare, meaning I wanted to actually be a person who makes decisions about treating people and to actually treat people. But what kind of turned me off about going to medical school was just the time requirement. I was 25 when I 24 when I graduated, and I really didn't want to spend 10 years in medical school. So that's kind of when I was talking to who now my wife is. That's when I heard about PA, and what I really liked about it was the shortened length. You're essentially doing now that I've been doing it for 8 years. I can say you're essentially doing the same thing as a physician. And I think it's again the specialty you like to do. I'm a procedural guy. If someone comes in as a trauma, someone comes in as a bad car accident, that I enjoy the sense of being able to take care of someone and save a life. There's something to that, to where everything you do to that point where you save a life. But it's also this is actually a question we had in PA school, like what interests you most? It's a puzzle too. If someone comes in sick, if you like puzzles, you like trying to figure stuff out. It's not like TV. It's not like Grey's Anatomy or any of those shows. The real world is very, very different than what those shows are like. Even Scrubs kind of gets it a little bit every now and then as far as the joking around. But people come in really injured like this, a trauma can have 10, 20 things wrong with them, and to piece everything together, what's the most important to the least important, and then figuring out what's going on. I thoroughly actually enjoy that. And that's kind of why I liked about trauma, about surgery, about critical care, about procedural skills. Now that I'm in the profession, but also the ability too of what I said earlier, to be able to potentially go to different specialties is also very enticing, because being able to theoretically, with the position I had at Hurley, because I did adult and peds, the opportunity to go to any specialty I wanted to was there. If I wanted to leave and go do pediatrics, I could have gone and done pediatrics. I could have gone to cardiology, cardiovascular surgery, anything like that. And that's kind of the nice thing about a PA. You're not locked down to, if you're an emergency medicine physician, you're an emergency medicine physician until you go back and have to get certified if you want to do something else and have to go through that. It's all on the job training, which is nice. So it leaves this area open to, like, if I ever wanted to go back and do, like I said, pediatrics, I could go back and do pediatrics later in life if I felt like I wanted to.
Yeah.
That answer your question?
Yeah. I also want to know, like, more like the differences between a PA and a physician. Like, if you can go more into depth into that.
Yeah, honestly, there isn't much depth to it, to be honest with you. The big thing, so in Michigan, the law, it used to be we'd have to supervise with the physician under direct supervision, meaning that if you were in a facility, the physician you were working with had to be there too. In May of 2017, a law came out in Michigan that you don't have to work under supervision of a physician anymore. You work under what's called a practice agreement. So it's a long legal document saying that you are working under a physician assistant. You work with them. So I know a physician assistant who owns a practice, has an agreement with a physician, and the physician's never been there. I think the physician lives about 60 miles away. So they practice essentially independently. So as a PA, you're practicing independently now. That's not the same for every place. It just really depends on where you work and what you want to do. So at Hurley Medical Center, where I worked, we were very independent, to the point where, we did care throughout a day. We might not see a physician for a day because the surgeon was maybe in surgery all day. And if there's anything important we'd have to tell them, we'd go and maybe call them and let them know. But a lot of times it was just you doing the care. Then we talk about the patient afterwards and then, hey, this is what we've done. If they wanted to add anything to it, they'd add anything to it. But you kind of get this level of independence as a PA that a physician has too. It's a little regulated, like I said, but you can still practice independently. And then really the other thing too is the shortened school length. So when PA school, the 27 months, the average what it is, that's medical school and about a year and a half of residency combined. So you're taking about 5 years of medical school and residency and putting those into about a little over 2 years for PA. It's pretty intense. PA programs are, and they're pretty notorious for that too, academically.
Gotcha. Thank you.
Yeah. Any other questions?
Let's see, there was one that was typed in. You said something about working in emergency trauma. How do you mentally process seeing people severely injured like that, and how do you mentally process it? Great question.
That is a good question, because I think you have to do it and see it to really get the feel for how you react to the situation. So, as I mentioned before, you need direct patient care hours to become to get your hours for school. So what I did is I worked at St. Mary's in Saginaw, Michigan. I became a medical assistant, and I couldn't get a job because they all knew I wanted to go to PA school. So they didn't want to hire me to work for like a year. But I went in and interviewed there, and actually lady there took me down to the emergency department, and they were looking for internally, but he interviewed me, and he actually hired me about like a couple weeks later into the position. And an incident that happened there was as a emergency department technician would help patients get out of vehicles and such. So this a truck pulled up with a purely Spanish speaking family. I do not speak Spanish. Looked fairly frightened. I get out to the car, and there was this, I think she ended up being about 80-year-old lady, maybe weighed 100 pounds, ghost blue, just unresponsive. And picked her up and carried her into the emergency department and just started working on her. And then, she ended up living, but ended up kind of going about the day. I think it's what you need to do to mentally process that type of stuff, because as trauma, particularly in Flint, I have seen people as young as 4 months come in and pass, and I've seen people as old as I haven't seen anyone 100, but I've taken care of people that are 100, but pretty old people. From all age groups, I've seen people come in and they've gone and lived, and I've also seen them come through and pass. It's about the remembering that you can only do what you can do, and not to take it to heart. And then the big other two is separation of life from work. You need to have that. You cannot bring your work home with you. If you bring your work home with you, and I've seen this happen to people, you will just can't handle it and you'll go crazy. You have to be able to go home and decompress, do what you do and enjoy what you enjoy. I like golfing, I like snowboarding, I like hanging out with my kids, I do that stuff. So when a bad day happens, I go home and I just try to click it off and not think about it anymore. But people handle things differently, so it's kind of hard for me to tell you how to handle something like that. But it's just the realization too that if you're doing that type of special, you're gonna have to go in the next day, and potentially the next thing could happen. The same thing could happen again. I remember a really hard week was in August of 2015 when I was covering night trauma at Hurley. And this is before, if anyone has watched the Netflix Flint Town, you've seen the development of the CAT project there. Actually, since that has developed, crime rate in Flint has gone dramatically down. But that was a hard week. I did a 7-day stretch where I did 7 12.5-hour shifts in a row. And we had 11 homicides that week. I literally had someone come in every single day, and not everyone lived. It gets taxing and it's hard, but it's just got to persevere sometimes. So you got for the people you can help, you got to be able to, you're mentally there to help those people.